Thank you so much for attending this session, Thriving Beyond Homelessness, Sustaining Exits, and Navigating Supportive Housing. I'm Ahmed Bonaktar. I'm the Senior Director of Research at the Canadian Observatory on Homelessness, and I'll be moderating this amazing panel of presenters. Before getting started, I'd like to mention that this year's conference, the National Conference on Ending Homelessness 2024, is being held on the traditional unceded territory of the Anishinaabe Algonquin peoples. The peoples of the Anishinaabe Algonquin Nation have lived on this territory since time immemorial. Their culture and presence have nurtured and continue to nurture this land. We acknowledge and celebrate the many First Nations, Métis, and Inuit peoples from coast to coast to coast who participate in this conference and lead the work to end homelessness across Turtle Island. Thank you very much for your participation in this session. So we have 3 presentations scheduled for this session. We'll start with our first presenters, Alana Jones. Alana is the Executive Director and founder of Borden Place, Inc. She is a collaborative professional director and author with over 22 years of experience and success in talent acquisition, change management, community outreach, and recruitment across higher education and nonprofit organizations. Alana currently leads the transformation of a personal care rooming house to supportive housing for vulnerable populations in Toronto. Please join me in welcoming Alana to the podium. Thank you.
Thank you. Hello, everyone. Welcome. For those of you online, welcome as well. Just wanted to acknowledge that the work that we're doing in Toronto, all land north, east, west, and south of us is Indigenous land. Borden Place, Inc., our research and the work we're on is the Treaty 13 and the Dish-Wanspoon territory. The Wampum Covenant is a treaty between the Anishinaabe, the Mississaugas, the Haudenosaunee, and the bound them to share the territory and protect the land. We humbly live and work here and aim to abide by this covenant, support Indigenous sovereignty, and to support Indigenous sovereignty and decolonize ourselves and our communities in solidarity with Indigenous peoples. A brief history about Borden Place, Inc. We were established in 2023 with a focus on ensuring that the 21 residents there would not be placed into shelters because the building was due for closure because there were about 68 infractions by public health, fire department, and municipal licensing standards. All of the staff that we had at 60 Borden Place at the time were individuals with lived experience and frontline staff with lived experience. So we had peer workers, but we also had frontline staff with lived experience. One of the things that we were keen about is knowing that community building would be key stakeholders for our success. A part of the process. Why am I so nervous? It's because I don't like reading off of this stuff, and I'm always talking from my head, so I'm going to step away a little bit. But one of the reasons when we took on this building, we thought to ourselves, we'll give ourselves about 18 months to be able to do this transformation process. And see, this is why I don't like technology. However, we spent some time, because I didn't want to be talking to people, I wanted to create a video. So we created a video so that it can kind of capture our journey and what we're trying to do. So hopefully we get this to work. The building was up for closure in 2022, December. And after a series of back and forth meetings, clearly we needed to mobilize. No one told me that we would mobilize to become a nonprofit, but that's what was required in order for us to have an operating license. And so really that's how we kind of came about, but almost by force. Force of community, advocacy of community, and just me thinking, I don't want to have these residents displaced. I mean, that was at the forefront of my mind. A number of residents have been there 15 years, 30 years. Like, this is their home. They'd built a community. This is their family. As chaotic as it has been, they're still a family. And I didn't want to see these group of individuals being displaced into shelters. We have transformed 60 Borden, and our new location is really to have transitional supportive housing. So moving away from that kind of dependent model, giving people an opportunity to be independent so that they can envision themselves not being at any of our locations, right? And being a part of society. I think a lot of people, when they were placed at 60 Borden, people placed them there and walked away. No one told them to dream. No one even told them that they could dream. And so people kind of just settled into a routine of being cared for in a way, almost like infants, right? And not even recognizing their full potential. And we really want to move away from that.
They're not letting people get away with everything. Just, they're trying to keep a much tighter ship. Why not? Because everybody has their own little personality or this, that, the other. You still have problems, but they jump on them right away. And they, rectify the situation. It's not Shangri-La, but it's more peaceful, more peace of mind here without things happening. And, it is what it is.
I think it's the little things, the simple things as, under a personal care rooming house license, you're required to do everything essentially. And so a way in which we're able to do that is to put stuff out, like buffet style sometimes, monitor for sure. Have people make their own sandwiches. They can't be in our kitchen. It's a commercial kitchen. We can't have residents at 60 Borden in our kitchen, but they certainly can make their sandwiches. They can, put coffee together by putting their sugar and cream. And of course, they say double. But those are the little ways in which they can. Laundry was often done for them prior to us being there. Now we say to folks, bring your laundry down. We'll help you sort your laundry, and so that they can do their laundry. Some people still need assistance, and I call them our legacy tenants. A lot of them are aging in place, what we call in the sector, and so they're seniors now. They weren't seniors when they came in. But I also know that if you don't use it, you lose it. And so those life skills of doing your laundry, they're now kind of slowly doing that. And then there's also the room cleaning, maintaining their room, folding their clothes, and the pride that people are now feeling. And those are the small incremental ways in which we're doing the transformation with the residents.
The management it's perfect because they're providing us whatever they can, clothes, food, clean sheets, bed sheets, laundries, like every week, it's proper laundry. So it's everything. Management is good. I think there should be more stuff, like probably a little bit gym, playing cards, more activities, or somehow more young people are coming here. Like I'm 30 years old, but there was a guy who's like 19, 20 years old. So they should learn, they can learn more skills, more things. So some kind of those programs or some kind of those equipment should be brought here so that, you know, it's entertaining and we can learn and we can keep growing so that we don't feel we're stuck here.
The first challenge, I would say, is always going to be financial. We're not funded to do this work, and so that would always be a challenge. More importantly, just on a grassroots level, because so many vulnerable populations with a myriad of needs were placed in one location, that is a challenge, right? You don't have the staffing levels to be able to provide adequate service. So that becomes a challenge, and you have folks wearing multiple hats. Those things present challenges for us to be successful.
Hi, babe. Can you help me to unload the car, please?
I was in the immigration detention because of my immigration status since I came here. Due to the situations I've been through, I really never had the kind of opportunity and freedom to go out and for myself and experience all these interesting experiment, I can call them, and see for myself. It's just great to have this opportunity. There's some people trying to start fresh with their life, they need support and it's just their normal routine, just to get back to the point where they left everything.
I was tasked with how do I have a sustainable housing environment that didn't involve traditional funding, right? The work needed to get going. So those early days, my pockets certainly bore the brunt of it. So kind of starting from the place of salaries for staff, and the needs of the residents, because in those early days, I was also talking with residents one-on-one and in resident meetings and saying, what do you want? They wanted their environment to look better. They wanted better quality food. And so those are the things that we started. And each thing that they identified, I started looking at my internal network, who could provide those things. When we did our fundraiser, our first fundraiser, the neighbors were the ones who donated some of our best pieces to us to get donor dollars, right? So that's significant. I don't think I will ever experience that in this lifetime. And I don't know how many organizations can say the same neighbors who said shut this building down are the same neighbors who have fought to keep the building open with Borden Place leading. Thank you. So I guess you're wondering, how do you kickstart a rooming house to transform into supportive housing? And we really needed to start in terms with building staff morale. And, we're not funded as an organization, but I knew that my now 24 years of working in the sector had taught me a few things. That staff deserve to have their benefits paid for 100%, not 80%, not 60%, but 100%. And so, I remember going to a couple of providers and they said, well, Alana, nonprofits don't do that. And I said, I'm not talking about nonprofits. I'm telling you what I want to do for my staff. I cannot compete with some of the compensation because we're not funded. So it's like, it's like your rental income and donor dollars that are keeping us going. But I can certainly ensure that I take care of them so that they can show up and feel proud about what they're doing. And so we have 100% benefits. Not a single cent do the staff have to pay to ensure that they have coverage. We also have short-term disability, and few nonprofits, even you sitting here today, I'm sure can't put your hand up to say you have short-term disability. Okay? So I encourage you to do that. The other thing is we really looked at how can we support our organization? Where were we going to get some of that support from? What were some of the skills that we had internally, right? Looking at how we could improve the residents, and you heard one of the resident talk about that, but what are some of the skills that they had? What were some of the things that they can bring to the table as well? So we, again, really built on that. And out of that, we formed our Run Club, and we had the garden program. You saw a mayor kind of attending to that garden program. And so there's two. At 60 Borden, we have the flower garden, and at 372, we have the vegetable garden. And that's something we're really proud of. The other thing we really looked at was establishing ourselves as a transitional supportive housing provider. So saying to folks, for sure you can bring individuals here to live with us, but we're going to provide all the support. We know you might walk away, but we don't want you to walk away. So let's really form a partnership. And so we were able to do that with the Toronto Bill program. We were able to do that with Access Employment. We're doing support. So again, just really being intentional about how we do the work. We got investors involved to say, do you want to contribute to a social good, right? Can you, like we need architectural services. We want to rebuild 60 Borden. Do you want to contribute to those services for free and really be a part of the process? And again, don't underscore the folks who said shut the building down. They have become our core donors every single month as a result of just ongoing engagement. The other thing before I wrap up, I just want to say that doing 60 Borden and Dinesh transformation really allowed us to see where the gaps in service are. And there's a lot of money in the sector, and I think we really need to just look at ourselves internally. How are we accountable to the dollars that we actually get funded for? I am not funded. Hopefully we will one day, but I just want to say we certainly can do more work to transform the lives of folks exiting homelessness without kind of looking at, am I going to get funding from the city? Am I going to get funding from the Ministry of Health? We really can be, in fact, impactful in ending homelessness. Thank you. I think I have 1 minute for questions, or is it 0 minutes?
No, I think you will have around 10 minutes for questions and answers.
Okay.
So I'd like to-
All right. Not doing too bad. Yes.
Thank you.
There's something called intentional collaboration, and I think certainly I'm happy to have those conversations. Once you don't tell me when we start those conversations that we can't do it. My mom said there was no such word as can't in the English dictionary, and even though Webster has updated and Marianne and Oxford, there still isn't can't in the English dictionary. And I think, so if you come to the table to collaborate, we can't get the same results if we have the same model. The model has to change for things to change. And too often we're having that kind of default That's our comfort zone. And so, you know what? I never even imagined, like in 9 months, we had our second building. If someone told me we would do that, I for myself would say, how, but it's possible. And so you don't need to replicate me, but you need to certainly come to the table and have those conversations with intention that we certainly can transform the system.
Also, if there are any questions, there is a mic in the middle. If you could ask your questions for the audience, that would be appreciated. Any questions from the audience for our speaker?
A beautiful thing.
Perfect.
I
Thank you.
began my career in grassroots organizations, and I think those are the leaders in that set the standard of like, we want it, we're hungry, and we have to develop ways to communicate with the people with surrounding us, right? And you've done that clearly. And you will get funding one day. My grassroots organization just got funding last year. So I'm not presently with them anymore, but they were the people that set me off on the trajectory of my career. And I'm forever grateful. So people like you set the bar, and we all need to like work as hard as they do and put as much heart in it as you do. Thank you.
Thank you. One of the things I forgot to add, when we started being at 60 Borden, no one was involved in any kind of vocational training or even employed. At this point, 20% of the folks who are in 60 Borden and at 372 are actually now working or involved in some kind of training. And so that is really incredible. And every single individual is connected to clinical care services. That's something that wasn't happening. And again, it's a lot of collaboration and a lot of pushing back to say, if you want to be a part of community, if you want to feel good about yourself, be a part of the transformation. And so the residents understood that, right? We had conversations with the neighbors, and residents said, I want to be a part of the transformation, but I always feel that the building has a bad rep, right? And so we slowly changed. In the early days, if you hit 60 Borden, you would see the 200 signatures for the closure of the building. Now I think we've gotten enough hits that Borden Place Inc. comes up. That's an incredible win for us. And so the other thing in terms of the funding, don't be afraid to walk away from funding. We were approached to be funded, but guess what? What was told is, you're not going to do the intakes anymore. You're not going to have, and you kind of have to change to the current model. And I said, thank you, but no thank you. I'm going to keep going. Right? So also be prepared to just really stand for the model that you have developed. And when we talk about best practices, know that the best practices you have to follow. We have this notion that we're going to regurgitate research. We have to stop doing that and actually put it into practice. When we talk about best practice, let's do it. Best practice is not just on the paper. Best practice should be moving and growing, and I really want to challenge people to do that.
We have another question.
Yeah, thanks for your great presentation. I was just wondering, you describe it as having transformed into transitional supportive housing. Is the expectation that residents will live there for a limited period of time, or 6 months, 12 months, or can they stay permanently?
So that's a great question. So we have two cohorts. We have our legacy tenants, and they're not going anywhere until it's time for long-term care, essentially. And then the new folks coming in, it's transitional. But we're in that process of saying, as you stabilize, then we talk about discharge planning. So as you stabilize, and that can be 6 months, that can be a year. You see, we have some residents that are a year, because for everyone it's different. But we're not kind of off you go at, that 1 year mark. We're working with people so that when they move from our locations, they're actually going into independent living. And so that's what we're working on. That's the transition we're doing. Again, a little bit of a different model in that most times transitional means 6 months you're gone, a year you're gone, but we're working really on the needs of the clients and where they're at and supporting them along the way.
Just a quick follow-up, how many people are living in the two buildings total?
Right now, we're supporting 12 residents. We're at capacity, 12 residents at 372, and then we have 27 at 60 Borden.
Thanks.
You're welcome. Thank you.
It's okay. He just asked the exact same two questions that I had. So I'll just say it was such an inspiring presentation. And yes, we need more people like you. So thank you so much.
Thank you.
Any more question for Alana? We still have time to take questions.
They can also email me because there's some other incredible presenters as well. Thank you. You've been gracious. Thank you.
Okay, thank you so much. Okay, we move on to our second presentation by Dinesh Moro and George De Silva with MAP Center for Urban Health Solutions and Parvin Merchant, HouseLink mainstay. I'd like to introduce them to you. Dinesh Moro is a research coordinator at the MAP Center for Urban Health Solutions with the Homelessness, Housing, and Health team, where he contributes to qualitative projects which explore people's experiences of housing transitions. George De Silva is a person living with HIV for over 24 years, lived experience of being homeless, a peer researcher since 2017, and a volunteer within the community. He became a peer researcher to share his life experiences and learn to listen to others telling their stories. George is currently working with Realize Canada, St. Michael's MAP Center, CAMH, and U of T on various projects. And last but not least, Parvin Merchant is the Director of Support Services at HouseLink and Mainstay Community Housing. She brings international work experience and perspectives on systemic issues related to poverty and healthcare. She has worked in housing and community mental health for over 16 years, bringing insights from the front line up to senior leadership. Please join me in welcoming them to the podium.
Hi, everybody. Can you hear me? All right, thanks. Thanks for the presentation, Alana. That's really great. Unfortunately, this is about research, but hopefully you'll find it interesting and maybe with some practical recommendations to carry forward. So yeah, thank you for joining us as we continue this conversation on supportive housing. Thank you for the introductions. My name is Dinesh Moro. I'm so glad to be here today with George De Silva and Parvin Merchant. We're really glad to be presenting on Home for Good, which was a program in which adults living in supportive housing were assisted with moving into private rental units in Toronto. Our presentation is a blend of three complementary perspectives: research, lived experience, and service provision. So here's an official land acknowledgement from the MAP Center for Urban Health Solutions. The research we will be presenting today was conducted on the territory of the Huron-Wendat and Pétain, the Seneca, and most recently the Mississaugas of the Credit First Nations. So our presentation will highlight strategies for facilitating transitions from supportive housing to the private market for those who have experienced homelessness. We will explore the important role of researchers with lived experience and propose recommendations for future moving on initiatives and the policies which fund them. So to get started, I want to provide some background on supportive housing and moving on initiatives. Supportive housing is defined by two important features: housing affordability, such as rent prices being fixed to 30% or less of income, and wraparound services to support tenants with their mental health or daily living skills. Research clearly indicates that supportive housing increases housing stability for those with severe mental illness and/or past homelessness experience, and can be an important step in recovery. However, there's not enough supportive housing in Toronto. As of 2019, our best estimates is that the waiting list for supportive housing is over 19,000 applications long. That number has likely continued to grow, as I had a conversation with someone earlier today who was doing work on that. So Moving on initiatives could address long wait lists since they provide people with the opportunity to move out of supportive housing while still maintaining connections to community-based services. This turnover allows new people to access supportive housing. Our presentation focuses on findings from a Move On initiative created by a Toronto-based supportive housing provider called Mainstay. So this brings us to the Home for Good program, which was a funding pool created by the province of Ontario and administered by the City of Toronto. The purpose of Home for Good was to help people who had experienced homelessness to obtain and sustain housing. Home for Good, as a funding initiative in Ontario, supported an estimated 2,400 clients overall, 1,100 of whom had experienced homelessness and were receiving follow-up supports after being housed. So now I'll hand it over to Parvin to talk about Mainstay's Moving On initiative, which was created using that Home for Good funding.
So we are Housing and Mainstay Community Housing. We are one of the biggest supportive housing provider within Toronto. As you heard from the research perspective, there are long people that are on wait list to come into supportive housing. Do we ever ask the homeless population, where do they want to go? What is their options available? Usually they have just been offered supportive housing and they come here. What happens next once they gain the skills, once they've recovered, once they've moved on? Or they don't require this support, what happens? They continue to live in supportive housing. There is no way that where they can go, and there is no way the supportive housing can take the new people that are still on the wait list. So this Move On component was created at the time, and we submitted a proposal so that we can move 60 individuals out of supportive housing into private rental market, so we can create room for people to come in and receive on-site higher support that they really need to move on in their life. So that's how this component had started. The other motivation that we had when we were speaking with our clients or tenants within our housing, they always said they wanted to go out and live within the community or the private market, but there is nothing there. Where else can they go? There is not much housing or options available because the rents are so high. What other options are there? They are on ODSP or OW. The market rents are just shooting up. So this was the funding that we received. Our funding was for 3 years. We had 3 years to house 60 individuals in the private market. We received $800 per unit, and addition would be their personal allowance or other pieces that they can add to find units within the community. What did we hear from these individuals when we talked to them about an opportunity to move out of the private market and leave supportive housing behind? They were all really excited. Most of them really wanted units that were bigger than what they had. So if they are in a one bedroom, they would want a little bit larger one. If they were in bachelors, they wanted one bedroom. And the other main piece that was there, why am I leaving this? I am right now in an RGI housing. If I'm going into private market, your funding is for 3 years. How will I survive after? Who is going to pay my rent after that? What is that going to look like? We didn't get much people that were ready to move on. We really thought we would be able to get more people to get into it. So the first offer that we put it out there, if circumstances change, for whatever reason the funding is not available, you have the option of returning back to HLMS at any given point. And then we had quite a number of people that were ready to move on and find unit. We have housing workers on site, but for this program, we also had a housing locator that assisted them, that provide transparent information, give them all the criterias, what are the landlord requirements, usually when you go to the private market, what are the other components that would be required. They may need documentation, bank, credit scores. Those other components are the other challenges because landlords don't want to house people who are on lower income. So that was another bigger challenge for us, is to get the documentation as well as get them ready for interviews, going around, a lot of rejections. It was a long and lengthy process for them because they couldn't see the light. What happened in the end was we only got 30 to 40 people that were ready to move on. But within the 3 years, we were only able to house 11 individuals in the private market. Again, that was a time of COVID where we couldn't go out much either. There were not landlords that were accommodative. There were some that were ready to house us, and that's when we were able to have 11 individuals housed in the private market. I will now pass on to Dinesh to talk about, from the research aspect, what did they hear from the clients, from the tenants about that process, and George will talk from the peer perspective about those components.
Yeah, thanks, Parvin. So the MAP Center for Urban Health Solutions was part of doing an evaluation of the Home for Good program. And our research question for this specific component was, how did participants in the Move On program experience the journey from supportive housing to the private rental market? So to answer this question, we interviewed 10 people who had moved out of Mainstay and were living in the private market. We used thematic analysis to find common themes between interviews and collected administrative and demographic data. So as you can see here, participants in our study were between the ages of 29 to 69 years old and had lived at Mainstay for between 3 and 23 years. Most were male, white, and enrolled in ODSP, which is an income support program meant for Ontarians who are in financial need and have a disability. Most participants had more than one source of income, which is, as you can see on this slide. So this slide provides a broad overview of the results of our study. In short, we describe the experience of moving from supportive housing to the private market in 3 stages. The first being deciding to move on, second, finding my new home, and 3, independent living. So first, participants decided to move on because they wanted to pursue a more appropriate environment to continue their personal growth. There were parts of life at Mainstay that they felt were stressful or stigmatizing, and they were confident that they could manage living on their own. The Move On program was therefore seen as a means of achieving this goal. When it was time to find a new home, participants felt really proud to search through rental listings and choose where they would live. Housing workers helped with the paperwork and liaised with landlords, which was appreciated. Nevertheless, it took most participants a long time to find housing. Once participants moved to the private market, most felt safe and happy in their new neighborhoods. They cooked and cleaned for themselves and were glad to have space to host family and friends. Unfortunately, COVID limited opportunities to fully pursue some of their personal goals, such as finding jobs or participating in community activities. By far the biggest challenge was affordability. Participants needed to maintain a strict budget due to annual rent increases, rising grocery prices, and stagnant social assistance rates. Not to mention, nearly all participants were paying far more in rent now that they had left Mainstay. So here you can see how rental costs changed for participants. So let's walk through an example to get familiar with this chart, and keeping in mind that housing is considered affordable when rental costs are less than 30% of income. So we'll start with participant 1, who had a total monthly income of $460. When living at Mainstay, they paid $120 in rent, which was 26% of their income and therefore affordable. However, when they moved to the private market, the cost of rent went up to $1,540. And after Mainstay provided the $800 rent supplement, they were still had to pay $740 out of their own pocket, which for this participant was actually greater than their monthly income. In this case, we know that participant 1 was receiving some money from family members, which made up the difference, but is not reported here. They were also able to find employment once they moved out, which helped them to maintain housing. But examining the chart as a whole, we see that nearly all participants were paying affordable rent while living at Mainstay, as evidenced by the green shaded cells. However, after moving to the private market, only 2 people were paying affordable rent. And you can see a lot of those percentages are upwards of 50 to 60, 70% of their income spent on rent alone. And that is with receiving an $800 rent supplement, which just goes to show how difficult it is to maintain housing on a fixed income. So now I'll pass it over to George to explore some key insights from the study and provide recommendations for service providers and policymakers.
So does this mic work? Yes, it does. Good. So you've heard from the service provider, you've heard from the data, and I'm here to speak about the tenants and the participants that were actually involved. So one of the things that was really important in the beginning, and I think a lot of research work and everything else, as a researcher, somebody with lived experience, building that trust to be able to talk and communicate with these people who have moved in, to tell us your story so we can collect this valuable data was really important. Building that trust, not only with us as the researchers, but building the trust with the service provider, the housing workers, and everybody else was really important to them. And one of the things I'd like to say also as an advocate, and Alana, you had mentioned this too, is we want to be paid a living wage as people with lived experience who are working in the research field or any other work. So please remember that, employers. The other thing that we did is we created a community of experts group, which is people with lived experience, and shared with the researchers from beginning to end of the research project our insights with people with lived experience on how to modify, change the questions, or ask the questions. Some of the things that we also found were, there was some pride and there were some frustrations. The frustrations began with landlord stigma. So once the landlords realized if they were involved in the program, Mainstay really had to advocate strongly for them to get over that stigma. But where the pride really came in is, like Dinesh said, they had a place that they can finally invite family and friends, and if they had kids, to bring their kids over. And it meant so much for them. And it also, they also commented that it's a more respectful place to live, and you'll see why in their quotes. Next slide, please. And so having that follow-up support from Mainstay was really important to them. They felt like they were part of the community, but that they were also being seen. And that to them was the most important thing. Just having a support isn't just the only thing. They want to be a person that's seen and can be communicated more effectively and active in their community. Was there some stressors? And COVID was sort of the biggest one, because in the research and in any research, we can't plan for all the inevitables. But I would say that when you're going to do any research such as this, think about adding some variables that could trip into it. And I'm saying COVID as an example, because that was a stressor to these people. How could we communicate? How were we able to use Zoom to do the interviews? How could we facilitate with getting their voices heard? Were a big part of this also. And the positives about moving out. I'm going to be speaking to this a little bit later in the next slides going on. So some of the recommendations that we found, that we want to ensure that we use people with lived experience to do the interviews, and again, paid the living wage. And we want them to be engaged from the beginning to the end. I was involved from the beginning of the project to the code book at the end to help with the data. So that was important also. And the old saying says, you can lead a horse to water, but you can't make him drink. These people can't be forced to move. They have to be ready. And as Dinesh mentioned, it was between 3 to 23 years of living at Mainstay before they decided to be moved on their own when they felt comfortable, which was really important. And at that time, they wanted something that was quick, something that was seamless, and something that they continued to have the support systems built into it also at the same time. And then when the tenants were moving out, one of the things that we would recommend is a flexi fund. And what we think a flexi fund is built for is not just for furniture, but think about it. Most of these landlords want insurance. Who has $300 or $400 to pay for insurance? So there's insurance, there's incidentals, pots, pans. These are all things that we might take for granted in our day-to-day lives that these people might not have. So creating this flexi fund for these people would be also helpful. And then also, they still want that support, but they also want to be independent. So we got to give them some level of independency at the same time as giving them the support they need when they want that support. So not always being attached to them, but letting them come to us at the same time. Everybody knows rents and governments don't necessarily support these programs as they should. And as the slide says, I think they must. support these programs going forward. Not only supporting them, but the back end, the support of housing workers, because those housing workers are key to helping and fighting with the landlords and working with the landlords for rental increases. But it's not just on one side. There has to be advocacy on the tenant themselves. They have to join groups, volunteer, and be a member of their own community at the same time. Lastly, that even though it says should, I've stamped it with must. These programs must continue to be funded. And as the first caption says, that, and this is their voice, that building, how could I put this without being rude? It's more crackheads, heroin addicts, and alcoholics, and there was no way that I could survive in that environment, and tried to control myself, so I had to leave. That gives you an example of the environment. And the last one is, I feel I can call them when I need them, which talks to the support that they were getting. But I'd like to go to the last slide, and it's the last caption that sums this all up. Once I moved from there, I came to an environment that everything is normal. People are cheerful, and you know everything is perfect. Down there, it was too much negativity. This speaks to getting out of the revolving door, from streets to shelters, and back to the streets again. It's moving away from temptations. It was also moving away from problems and all of the difference of living a better life. So that's why these programs are so vital. And as the program name says, this is home for good. So let's keep them home for good.
Our time is up, but I'll take 2 minutes to just summarize. The question remains, till today, are these people continue to remain housed, or what happened? Yes, those all 11 remains housed. One of them sadly passed away this year, but the rest of them remain housed. Does this $800, the chart that you saw, is it enough? No, because more than 100% of the income that they have been paying towards their rent. Can they survive? Can they thrive with this? No. So we have taken out all of those individuals that were there. They continue to remain where they were housed, but we were able to get them different kind of a subsidy and move them from this regular program that they were there. And we have given them different subsidy, and we cover their 100% of their rent, so they don't have to utilize their personal portion of their income that they get, and they can be under affordable housing again. So that was the main piece here. Lastly, I would just want to talk about why is it so important. It is important so that we have this component for supportive housing, so that we can make place for on-site support for individuals that require higher support can live there. Because once you move into private market, yes, you can ask for support, but those are small supports here and there. They can make the call. They don't get programmings within the building. They can go to drop-in centers, but they don't get within their building. So those support that people require higher support can come on and live on an on-site, and others can move on once they are graduated from this program. Tenants are really happy where they are at. They are really enjoying their units, and they want to continue to live where they are at. Lastly, I would say for policymakers, we would want to advocate for this program. I would want to just highlight in the one of the slide, if you noted, only one individual was at 0% of the affordability because our rent had covered the entirety of it. It was because the government had advocated in the earlier days when there is a new development, there should be some affordable housing. So this individual got one of those, it was a lottery ticket, and he got those units, and that's why it was very affordable. So if we can continue to have more those kind of housing with the new development where there are a number of affordable units, most of our individuals can get that. And it should be a continued with them, and not just with an organization, but with individual wherever they decide to move on. They shouldn't be feeling stuck wherever they are. The other is the policy makers should also keep in mind the inflation and the increasing rent, so they don't have to worry about moving on with the prices fluctuating and the rents going up. So those are the main components that we came out of this Moving On initiative. Here we have the information of the researchers as well. If you wish to contact any of them, then please do so.
Thank you so much for your great presentation. It seems like it's part of a large body of work. Okay, I would like to take questions. There's a mic in the middle, and then our amazing volunteers would grab. Okay, here.
Great presentation. Wonderful to see Moving On initiatives being implemented and evaluated in a Canadian context. I think we're very much well behind the US with regards to that, and we need Section 8s for Moving On of some kind. My question is just around the readiness component. You use the term readiness a lot. Is it entirely choice-based, or is there some functional assessment that accompanies that?
Thanks for that question. Readiness is when the individual feels that they are ready, because most of our individuals that are residing with us are 15 to 20 years. So most of the time, the conversation was with the housing support worker to see if their goals are ready, and they have achieved what the goals were in the initial days, and so that was the main readiness piece. Most of the time, the readiness came from the individuals only, that they felt that they are ready to move on, and they agreed that they would be out there where the staff would not be on site to provide them that support. Because sometimes we as workers feel that this individual is ready, but does the individual feel that they're ready to move on? So it was both the sides.
Another operational question. I live in Calgary. My organization runs a 25-ish unit, like place-based supportive housing building. We have these conversations often. When you said the program adjustment that you allowed for people to be like, just go try it, and if you need to come back, this is fine. How do you operationalize that? We have, right, as soon as people move out of the Maple, people move in.
Yes.
But I want to make what you said happen.
Yeah. That was a tough piece because it took us a long time, and that was in this 3 years component. That's why we were able to only house 11 people. We had to make that promise so that they move. We kept the promise, but sometimes it takes a while until a vacancy becomes available, then we can bring them in. What we have come up after COVID is we have kept some respite units. So that really helps in case for an emergency that they have to leave, where there was a situation where the gentleman was on a wheelchair and he damaged the unit. And I had to bring him to our respite unit. Once we worked with the landlord and repaired, he was able to go back where he was. But there are times when it happens. But that's why we kept those respite units for those durations.
Did anyone return to full-time supportive housing living?
Nobody. They all are living there, the 11 of them. Just one passed away, but they're all in the private market still. Yeah.
And I just want to add, the one that passed away, was really happy that he was able to finally move out and have a place on his own so that he could call his own before he passed away. And he did have a relationship with somebody, and he was able to accommodate that person. So to him, he expressed how it changed his whole life at the end.
So I would add to what George said. That gentleman got the units through the lottery, so he was under the 0%. Once he passed away, we were able to get the same unit again from the landlord, but the rent jumped 3 times more. And again, we couldn't afford to have from this funding. We kept the unit, but we were able to fund it through different funding, and we were able to have somebody else outside. Yeah.
Is there time for my question?
Yes, yes.
Yeah, okay.
Yes, go
Thank
ahead,
you so
please.
much for an excellent presentation. 2 quick questions. One is, you mentioned 21 people were in transition. I just wondered what you meant by that.
So 21 people were in transition because 11 only got housed into private market. Those 21 that registered to go into private market didn't get out within this program. But we supported them to find another units of their choice. These were all 21 living in a bachelor unit. They wanted a different location. Locations was all their choice. Some would want only east, some would want west. Some did get housed within supportive housing. Not every 21 got housed into private market, but it was their choice wherever they were able to, but we were able to transition out from where they really wanted to move from. Because this program was at a building with 140 units, so some people wanted to have a smaller community. They didn't want it to live in a larger building, so they were able to move to a smaller building, but within supportive housing.
Thank you. Can I ask another question?
Yeah.
Yeah. I found that chart that you showed super helpful, like the percentage that was going towards rent. Out of the 11 people that you interviewed qualitatively, did anybody say, oh man, like this is worse, or this is way too stressful for me?
I think people did feel the crunch for sure. And we had interviewed them at a time before that funding switch had happened. So people were slowly starting to feel this sense of the budget is decreasing, it's harder for me to afford food, all of these kind of things. And the rent would just keep increasing year after year. So people definitely talked about that. It was definitely one of our main findings from a qualitative perspective, and just highlighted as well by the numbers there too. So the fact that HLMS was able to make that funding switch was massive for people to actually remain housed. Otherwise, it could have been either return to supportive housing or potentially recurrent homelessness, right? So.
And remember, COVID had just hit too. So some of them that were employed were either laid off or transitioning. So they had that concern of, am I going to have a job after this? And that's something that we couldn't capture in this. So we don't know whether they got work back after COVID. So these are the numbers, they're static numbers based on the time that we did our research.
From the time of the research till now, till 2024, they always said the biggest challenge was the cost of living, the high cost of living, and that was the only reason that we moved them. It took me a while to find, it took me 6 months to find a different income source, but we were able to get them. So currently we have 5 people still on this funding, the rest are all on the new funding.
Thank you.
We might have time for one quick short question or comments. Any comments? Okay, let's give them a round of applause. Thank you so much. Okay, we're moving on to our last presentation, last but not least, by Carrie Anne Marshall and Diana Hughes. So Carrie Anne Marshall is an associate professor and director of the Social Justice and Mental Health Research Lab at Western University. Her research explores intersection between poverty and mental health, with an emphasis on homelessness prevention through supporting thriving rather than solely tenancy sustainment following homelessness. Diana Hughes with Providence Care. Diana Hughes is a peer support specialist in the Peer to Community program in Kingston, Ontario. She has several years of experience as a community advocate and lived experience consultant in the areas of homelessness, corrections, mental health, and addiction in women experiencing marginalization. Please welcome them to the podium.
Is it a touch screen? Starts working. Thank you. Yeah. Hello, everyone. It's so nice to be here today. Nice to see some familiar faces. It's just kind of in reflecting on the last 2 presentations. It's really nice to talk about the transition to housing following homelessness, rather than thinking about kind of supporting people only while they're unhoused, and really thinking about that transition following homelessness. It's also really nice to talk about thriving rather than just survival, and thinking about how we can kind of raise the bar and think about how we can help people to kind of of, achieve well-being following homelessness rather than solely having a roof over their head. Having a roof over their head, super important, obviously, but also, helping people to thrive in their communities afterward is really, really important. The other thing that I didn't expect to hear as much about was the inclusion of lived expertise, and it's been nice to see this in all the two presentations that happened beforehand, and that's what I'll be talking about. And I have the pleasure to present with this lovely lady as well, Diana, and so we'll both talk about that. So I'm going to talk about the research that we've been doing. So I'll put you to sleep, and Diana here will wake you up by talking about kind of her experience as a peer support specialist. So we're here today to talk about the Peer-to-Community program, and I'll just kind of provide you with a background on how we created this program, how we partnered with persons with lived experience, service providers, and researchers all working together to kind of create what this kind of model would look like. And the model itself is aimed at helping people to thrive following homelessness. And when we're thinking about thriving, we really wanted to target specifically community integration. When we talk about community integration, we're talking about, helping people to build networks in their community. We're talking about helping people to, know people in their community and feel like they belong in their community. So it's not necessarily making connections with other services. It's about having real, authentic relationships with people in a person's life that choose to be there, and that we know most of us have, and that we know can support our well-being. There are a number of people who've been involved in this project, and so these are just some of the researchers and community partners who have been involved. And we have a couple here today. So we have Sarah Collins, who is here from the Salvation Army Centre of Hope in London. We have some others. I'm not sure who, I can't make out if there are any other researchers in the group, but their names are here. This project was funded in 2 phases by the Canadian Institutes of Health Research. So the first part of it was a co-design process, and the second part of it were a community-based participatory research study, and that kind of resulted in a co-design process where we created an intervention, and now we're piloting the intervention. So I'll kind of spend some time talking with you about how we created the intervention through partnered work, and how we kind of switched into piloting this intervention that we've created together, and how we're sort of evaluating it. So I kind of, hinted at this at the very beginning, that, we know from research on homelessness that people are not always thriving following homelessness, that they secure housing following homelessness, and sometimes even struggle to kind of integrate in their communities. They struggle to obtain well-being following homelessness. And I think, we could raise the bar as a society and try to target more than just housing alone. And I'm sure that if we went around the room and we shared stories about individual people we know who secured housing following homelessness, that some people do really well, and they kind of integrate in their communities. They attain well-being, and they're able to sustain their housing. But some people really struggle in their housing following homelessness, and so this is what this whole project was really about: is how we can better support individuals who fall into that group. Really thinking about it through a homelessness prevention lens. If a person's thriving in their housing, their chances of that tendency kind of lapsing or returning to homelessness theoretically would be decreased as a result. Housing first. This project was also built with a housing first kind of philosophy in mind. We know, however, that housing first is very good at helping people to secure housing following homelessness. It's not very good, and to sustain it for longer when compared with other types of interventions. But when it comes to targeting other outcomes, no intervention is a panacea, and housing first cannot be expected to be a panacea. What we know from research on this topic is that Housing First is not very effective at helping people to integrate in their communities following homelessness or kind of find belonging in their communities. And so kind of, the idea behind this is that we felt very strongly that something needs to be added on to Housing First or delivered in concert with Housing First to target some of these outcomes, knowing that Housing First should not, no intervention should be considered to be a panacea for everything. So we kind of partnered with organizations in 2 communities, London, Ontario and Kingston, Ontario, and we established 2 community advisory boards in those cities. We then kind of went out into the community and we asked the question, what do people need to thrive following homelessness? So this is before we decided to target the outcome of community integration. So we, met with, service providers and persons with lived experience, and we conducted some qualitative research, and we generated some findings from that research and got some ideas for what we might kind of, target, in terms of our co-design efforts. We presented the findings to the community. We drew the kind of, different, community members into this process all the way along. And then we worked together to co-design some kind of an approach. We didn't necessarily have an intervention in mind, but, some kind of an approach that would help people to thrive following homelessness. There are a whole bunch of people who were involved in this work in the Kingston community and in the London community. So we did, we really drew in a lot of different kind of community representatives. We released 2 reports so that we could kind of take the findings of our sort of consultations and share them throughout the community. So we released one report on the left-hand side called the Beyond Surviving Report, represents data from the Kingston community. The one on the right called We Need to Genuinely Listen to What People Tell Us They Need is on the right-hand side. You can access those online if you're interested, or if you just reach out to me and I can share them with you. They're pretty widely available. And they represent the perspectives of service providers and persons with lived experience on what they need to thrive following homelessness. We published a few papers. This one was, a systematic review of the experiences of transitioning from unhoused to housing following homelessness. We then published 2 papers. One was focused on the lived experience perspective, and we used a participant quote to describe what the participants told us as in the title. So I can't remember the last time I felt I was comfortable about being home. So a lot of people were saying that they were really kind of languishing in their housing following homelessness. And then the service provider perspective, again, we used a participant quote as the title. We stick people in a house and say, okay, you're housed, the problem is solved. So I'm sure that if we, shared perspectives around the room, that there are service providers who might kind of like, really have a good sense of what that sentiment was all about. We then took all of that qualitative information, we talked about it a lot, and we co-designed 4 different components of an intervention. We decided to focus on an intervention, and we really wanted to kind of, really draw in lived expertise, recognizing that kind of peer support exists in the mental health sector, but it has been slower to come to the housing and homelessness sector. So the group really felt strongly about that, and we brought kind of, we decided to design this peer support intervention called the P2C program, or the peer-to-community model. We also co-designed a fidelity measure that would help us to kind of determine whether we were, an organization, or we were delivering the intervention in the way that it was designed to be delivered. We co-designed educational modules for training staff in the program, so peer support specialists. We developed a workshop for peer support specialists. We developed a workshop for all of the staff in the program. And then we also co-designed an evaluation strategy. This is the graphic that describes what our model is all about. And, at the kind of heart of it is really this idea of community integration, that we sort of really, want to target community integration. And the way that we, the mechanisms behind which we hope to help people integrate in the community is through helping them to engage in meaningful activities that perhaps they haven't done in a long time, or they would like to do, or would like to discover, and relationship building. And the focus on meaningful activities was really about, like, if you think about everybody that you often know them through the things that you do with your time. So that was kind of the idea behind that. The service providers include an occupational therapist, and in the original model, a social worker and peer support specialists. And the idea behind the social worker and the peer support and the occupational therapist, their role is really to provide specialized services from their disciplinary perspective, but mainly to help prepare peer support specialists to kind of identify opportunities for programming, and to help to build capacity in the peer support specialists who would then take over and deliver the programming independently. So that's kind of the idea behind this particular model. There is a community space, a place that people can kind of come and connect with peer support specialists without an appointment, and where group programming is delivered. And a support meeting where it's actually turned into a daily support meeting among the staff in the peer community program, where they provide opportunities to talk about complex cases, talk about kind of some what might be kind of affecting their own mental health, and to help to mitigate moral distress and moral injury. That was the whole point behind it, because we heard a lot when we interviewed participants, service providers, and persons with lived experience, that there's an awful lot of moral distress, and we wanted to mitigate that. We then kind of published a paper on our co-design process, and if you want to access that, that one's freely available as well. We then kind of applied for some funding and were able to obtain some funding to pilot this intervention. And so we have been piloting over the past year and a half in the Kingston community. This is our building. We enrolled 28 participants in this study. And to be involved in the study, the participants had to have had at least 1 month. They had to have been unhoused at least once in the past year. They had to have been housed following homelessness, and they had to be over 25. We felt very strongly that this was an adult model. It was not meant to be a youth model, and that perhaps that could be created in the future, but we really wanted to focus on that. And everybody that was enrolled at the beginning identified as having both a mental illness and a substance use disorder, which are one and the same in many ways. So this is just, it's like we've been collecting data over 3 months over the past year and a bit, and we're about to embark on our last kind of data collection period in November. And this is just kind of some qualitative findings from our 12-month interviews, because we have a lot of data, and I want to give Diana some time to speak as well. So the general kind of the general idea around so what we've been hearing in our qualitative interviews, which I think are really quite powerful, is that community integration is a really slow and kind of challenging process following homelessness. It doesn't happen overnight. And in many ways, I wish we could, pilot this intervention for longer than a year and a half, because it really does take quite a long time for people to build those relationships in the community. In our 12-month interviews, what the participants were saying to us, the first theme was that, the peer-to-community program offers a safe place for people to go. And one of our participants said, I just enjoy the company, the interaction between people, the coffee, the real coffee, and just being there, not the instant kind, And then it's like a safe haven, a place where people can go and just it's not a drop-in center, but a place where they can go and know people. The second theme is, the participants talked about how they still felt lonely, even after 12 months of receiving support in this program. It just feels like every aspect of me was stigmatized, so that it's it's all that I know. And this person was talking about kind of this persistent loneliness that kind of, stayed with him following homelessness. And then the third theme is, I've been working towards my goals and hope for a better future. So the participants were really talking more about their future, whereas in our original interviews, we're really talking about, I'm just in my housing now, and really just trying to adapt to that. And then finally, and so one of the quotes from the participants in that, with respect to that theme, is, I was ready to get clean, I was ready to get focused, I was ready to get healthy again. So just reflecting on their journey over the past year. So kind of in summary, co-design is the hard way to do things, but it's a challenging process, but it's also very, very rewarding. And I would encourage you to try it out if you haven't already. It's been a real challenge to change culturally, to switch from a CBPR process, so community-based participatory research, into something that's more experimental. So in a CBPR approach, for the researchers in the room, it's kind of all flexible. We can change everything all the time. But if we start kind of like measuring something and implementing an intervention, you can't change anything. And I'm kind of looking at Sarah now. It's really difficult. I think it really difficult for members of the Community Advisory Board to really adapt to that cultural change. Would you say that that's fair? Yeah. Peer support is such an important component of services designed to help people to thrive following homelessness. And I really hope that, I think we have some, important findings. And I really hope that if you haven't considered incorporating peer support in your programs, I hope that you consider that moving forward, because I think, peer support specialists do something that, other, professionals cannot do. So now I wanted to hand it over to Diana to talk about her experience so Diana's been working as a peer support specialist in the Peer to Community program. She's there every day, and she has such a wealth of expertise, and it's been such an honor to work with her. Diana, did you want to come up here, or do you want to stay there?
I'll come up.
Oh, you can, wherever you're comfortable.
Sure.
Yeah.
Oh, hey.
There you are. That's that nice picture of you.
Thanks. Hi, thanks. So, as Dr. Marshall was saying, I'm a peer support specialist in the Peer to Community model. I was asked to do this 5-minute presentation near the end, and I'm thinking, okay, what do I say? I was like, with my coworkers, what do I do? What is it that I do? To put on paper, and I crumble it this way and crumble it that way. So I'm just standing in front of you guys just to say my job is freaking fantastic. Absolutely. I get to bring and help find the best in you. Bring back your talents, your skills, your hobbies that you lost, that I lost before, right? My little peer to community is actually Elizabeth Fry, Kingston, shout out. And that's my safe haven. That's my support system, right? And it's a different kind. It's not following homelessness. But this support system here, we've had successes to where, and it's only been 18 months, and it's kind of not fair because we just started rolling. And in 2 weeks, we're done. It's really sad, but we've had this little tiny entrepreneurial social enterprise thing there, and we've actually got our participants got an order from the community pot shop, she smokes, and ordered 25 t-shirts that she's making, and she's making a profit, and she's going out, and she's going to be getting more people to come in. Now, this is all just happening, and now we're just going to be closing, but another one, he wouldn't leave his home. He didn't like to meet people. He was, skeptical, this and that. And my God, he's almost there all the time. He's given ideas where we should go on an outing, just even a nature walk, just to get in the community. We have a community garden. What else can I say? Okay, their health. Health is a major, major concern. I am trying to gain trust with service providers in the health field, but I get stigmatized still. I feel like I do. Maybe I don't. But because I feel that way, and a lot of our participants feel that way, they don't go. We're not going to go get fixed. We're just going to get sicker. And no offense to my colleagues, but one of our participants, oh my God, I'm so glad you're coming with me. Because if it was, I probably wouldn't have went. And she got her teeth pulled, and she's getting dentures, and she's gonna smile, and so things like that. I never give any ideas. I express my experiences and what I did, but these guys come up with it on their own. I kind of maybe help a little bit, but, and when they come up on it on their own, you watch how fast they get in a routine. Like, these guys are actually starting to get in routines. They're waking up. They'll even call just to say, hey, like, seriously, hi. And so it's a great sense of community. They're back out there. We have another participant who likes to draw. We hook them up. Oh, and another thing, we do not duplicate any other services out there, because if you need a resume, we have a place where resumes, you know, are going to be from another service provider. Now, I will come with you if you need to, absolutely. But I guess that's what my role is, and it's freaking fantastic because I get to see and see everybody's best in them, and I think it's great. So, thanks. Oh, and we're now family. Just saying. Yeah, we're family now. Yeah, once you come through the P2C, you'll never leave. Oh, well, no, we want you to leave. but yeah, you know. Thanks.
Thank you so much. Any questions for Carrie Anne and Diana? Please come to the mic. Any questions? Okay, we have.
Thanks for the great presentation. I was wondering, could you clarify, you showed a building, and it wasn't quite clear to me what goes on in the building. Is that housing? Is that activity? Like, could you just please explain?
Sure. So I sped through that. Can you hear me okay? Okay, yeah, so the building itself is really a community space where people can kind of come and feel like they belong. If you think about it as it's not a drop-in center, but it is a place where people can come and see a peer support specialist for without an appointment. They can, they offer group programming in that building. There are, I touched lightly on this idea of social enterprise, and Diana brought it up as well. So that's one thing that we kind of encourage is social enterprise. And so there's some kind of like social enterprise activities that are happening there. So that's kind of it's mainly an office for the staff, a group programming space. There's a small kitchen. And it's really, if you think about, way back before we had to text someone to pop by their house, it's kind of like a place where people can just drop by and feel like, they have an extension of their home outside of their housing. But we don't offer housing as part of the program. This is really just a support program following homelessness. So the participants are housed in market housing. They're housed in, some are housed in transitional housing, supportive housing, and so on. But that is something that is happening beyond our kind of control. But they're all, anybody who was enrolled at the beginning were people who were housed following homelessness. Throughout this the project, there have been, obviously some people have lost their housing, but we haven't discharged them from the program at that point. We continue to follow them and continue to offer them supports using a trauma and violence informed lens.
Can you just clarify how you got, how was the building obtained? It's quite expensive, right?
Yeah, the building itself, it's brand new, actually. We partnered with the Anglican Diocese of Ontario. A member of the Community Advisory Board had a connection with the Anglican Diocese of Ontario. They were aware of this building. They offer it to us at very little cost. And we've partnered with local organizations as well.
Thanks.
Yeah.
Thanks so much for a great presentation. My question is for Diana. So Diana, I'm a researcher, and I know what you mean where it's like 18 months is gone and you just feel like you're getting going. So do you have any advice for us, those of us that are trying to design interventions, like Carrie Anne's trying to design, like how can we get traction, sooner than 18 months? Or does it take that much time to build trust? I don't know.
To me, in the beginning, because it's literally on paper and we're like 3D building it, I was just walking around in circles. So it probably would have been a little quicker had I even knew what I was doing. So I didn't really know what I was doing either. I think if we had, and again, it's just all bringing it to life, more structured in the very beginning, I guess, it would have been, I think, a little quicker. I don't know.
That's great advice. Thank you.
Yeah, and I think Diana's like referring, and correct me if I'm wrong, but referring to how like it's a brand new team all of a sudden who's just being, learning how to deliver this intervention all together. Yeah, without kind of, rather than joining a program that's been running for 5 years.
Right.
Yeah.
Thanks.
Hi, thanks so much for your presentation. This is also for Diana, and kind of piggybacking off of that last thing, do you have any advice for other communities or other, like to try and not replicate this program exactly, but to try and do the same thing? Like for you yourself, what could be like the support or training or guidance that would be needed to support the peer specialist to be able to do the facilitation of the program?
Yeah, no, that's a really good question. And thankfully, the team I have, my team, and like we already discussed, every morning is guaranteed. We do, like, how am I feeling? How are you feeling? Like, it's our participants, but we can't do any service to them if I'm not feeling well. So, yeah, I think the biggest thing is to make sure that the team you're with, who likes working with their coworkers? I do. Like, I mean, we really do have that communication. If one of us is struggling, we're there. So I think that's huge to be able to have that relationship with the team.
And then as well, just quickly, how were you recruited to be a part of this? I'm just curious as well.
Through Elizabeth Fry,
Okay.
there was a posting at the Providence Care for peer support and a workshop. It was just a workshop. So they put me through the workshop, and I've always wanted to peer.
Awesome.
So yeah, it was through that. And then later on, an actual job posting.
Do you mind if I add?
Yeah, go ahead, sure.
So when we delivered the peer support specialist training workshop, which was a 2-day curriculum, so we had a group of persons with lived experience from our community advisory board. We developed this 2-day workshop together. Diana participated, and she was a total superstar. So we contacted her when we were hiring. Yeah.
Awesome. Thank you both so much for what you do, and thank you.
Thank you.
Thank you. I'm wondering if you can speak to maybe like what you're expecting to come out of the pilot project as far as different applications. I'm thinking I have a supportive housing hat on, and I wonder about how many of those people are neighbors? How many people know each other back in the community, and how does that get integrated? Is it on a model that really has to be community-based so that people show up in this third space, or is it, no, that we can integrate, I can see how we can integrate the model into supportive housing, but wondering what the expectation for the research and for continuing on the model in the Kingston community might be.
Yeah. So we're we're measuring outcomes every 3 months. So we're interviewing participants with qualitative interviews, but also a number of different standardized measures where we're asking them about kind of their social networks and that sort of thing. And so we have some outcomes in that regard, and we're hoping that data can kind of help to advocate for funding such programs in the future. I think in terms of like a space in the community, I think if it's located within housing, within the person's own housing, I think that could work. But I really, in terms of community integration, it's lovely to have an opportunity for people to leave their own housing and to go out in the community. One thing that we didn't mention is that a lot of the programs that we offer don't happen just at that community space. They happen all over the community. The participants, for example, went to to the fair together, like just events. They were judging a poutine contest, things like that. They're just regular stuff that people do that they didn't necessarily have a community of people to do those things with before, and now they do. And so it's those kind of like basic things that have been, I think, the most meaningful. Diana can probably speak to what it looks like on the ground because she's delivering it. But I just, as a researcher, I have to sit back, and it's really hard to sit back and not get like super involved. So, but I get to observe what I see happening, and yeah, I think the idea of having the community space beyond housing is something that I think is important. Mm-hmm.
And yeah, I'll just add to that too, because like Dr. Marshall said, not all our programs, not everything is ran from there. That's just more of a a space that's open, that if you need someone, you come, right? Like, so we do outings back into the community. We've gone, oh my gosh, we've gone skating, literally at the outdoor rink, right? You know how much fun this one guy said, I've never been able to bring my kids to the fair. Okay, so the Kingston Fall Fair. It was fan-freaking-tastic to watch these grown men be little kids again. And man, I don't know, things like that. And they just got so excited. And they're like, what are we doing next time, you know? And that's where they find the connection to the community. Oh, all of a sudden, wait, you want to operate my fair wheel? Like, I don't know, maybe, you know, they just connect with other just regular people. Yeah.
Great, thank you all. It's 5 p.m., so that would conclude our session. Thank you so much, our amazing presenters. Let's give it another round of applause.